Snapchat mo yan.
Jason, good morning.
Good morning, Suleiman.
Yos nga ora? morning, Jason.
Christy. Hello. 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 Can you hear me?
Yes.
Hello. 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 Hello.
Yes, we can hear you.
Okay.
Steve. Steve. Benar anda sih? Tidak benar si sport.
Yes, Cam.
Yes. Boleh benar dong. Ini belum sport. Hah? Rasa. Yang baik. Tapi yang Bang.
Hello? Yes, ma'am. Yes, ma'am. Okay, okay. I'll mute. Mute online. Video off video.
Hello, sir. Good morning, sir. Kamu Fila? Okay. Fila join mo sir ng IUE? Hall. Yeah. Hall. We'll 11 o'clock, sir. It starts at 11. We're going live to set up everything, but 11 o'clock will start, sir. Oh, sir. 11 o'clock, sir.
Hello? Hello? Steven, can you hear me? Steve? Steven, can you hear me?
Yes, we can.
Good.
Hello. Hello. Kim, can you hear me? Hello. Hello, Kim. Hello? Hello? Hey, I can't hear anyone. Hello? Hello? Stop, I can't.
বিজি আছে রে, এটা বিজি নয়, এটা কি জুম? অলপ আরোগ্য মানখানৰ যে আজি না পাবি তো আছে হ্যাঁ আছে না আছে মই জল চেক কৰিছো তো বলুন আছে আছে সব নিচে দিবি নকল একটু অন্য লোক
Checking.
Lucy.
Yes, sir. Kim? Hello, Kim? Hello, Kim? Hello, Kim?
Hello. Hello. Let's go. Which one? Hello. Hello. My testing. Check 1, 2, 3. Can you hear me? Okay.
Just saying hello, hello.
Stacy, can you hear me?
Yes,
Am I audible?
yes, yes, you are.
Okay. Okay. Thank you.
Hello. Can you hear us?
Yes, we can hear you.
Hello, I can hear you.
We can hear you, sir. Hello, can you hear us there?
Yes, we can.
Okay, thank you. Just for
Testing.
testing purpose.
Hi. Good morning, Oscar. Morning.
Clear. All set.
Hello, Sonata. Hello. Can you hear me?
Yes, I can hear you.
Okay, okay, good.
Hello, Scam. Hello, Scam.
Mute her.
Brandon, can you just try once?
Check, Scam. 1, 2, 3, check.
Yes, audible. Clear.
Alt to show meeting control.
Okay.
Yeah.
Tak nak dia. Unmute sama.
Your available balance is insufficient to make this ISD call.
Pangit.
Ini nggak ada. Halo.
On dengan. Oh.
A very good morning and welcome to today's presentation on how MHIS PMJ has built a bridge for public healthcare infrastructure and quality of service delivery. The live streaming of this discussion is also available on our website www.mhis.org.in and YouTube. I am Stacey Pata from the State Nodal Agency, Meghalaya Health Insurance Scheme, will be your moderator for today's discussion. Thank you for taking your time and joining us today. Okay, before we start, a little background on MHIS PMJ in public hospitals. Since inception in 2013, implementation of MHIS has introduced a claim revenue sharing model in which funds generated from public hospitals were utilized for infrastructure upgradation at 70% and staff incentive at 30%. The model has been improved with the implementation of ABPMJ, in which utilization of the funds were further broken down into 70% for infrastructure, 25% for incentives to staff, and 5% towards reversion to the state. Over the years, we've witnessed a few transformations at facilities that has helped address gaps at different healthcare facilities in the state. We had hospitals utilizing funds for upgradation and repair, renovation, and installation of ACs, painting of the pediatric ward. So many activities that has been undertaken, which has provided a much more friendly environment to patients. Other procurements include generators, ambulances. In all, there are 14 generators and 3 ambulances that have been procured from MHIS funds. Medical equipment also, other procurements like medical equipment are also included, like infant radiant warmer, dental chair, major lab equipment like ultrasound, dragger machines, and other lab equipment and medical equipment. These transformations have added value in provision of quality service in our public health institutions. So to discuss this matter further, we have with us 6 panelists. I'm very honored to introduce our Director of Health Services, MHIS, who is our Chief Executive Officer, Meghalaya Health Insurance Scheme, Dr. Aman Wad. Welcome, sir. Director of Health Services, MPH, also our Joint CEO, Meghalaya Health Insurance Scheme, Dr. Mrs. N. Wansworth. Welcome, ma'am.
Thank you.
And Shri Ipala, SDO, West Happy Hill, representative from the Health Engineering Wing. Welcome, sir. These 3 panelists will be speaking to us and give us insights and perspectives about the administrative point of view. Further, we also have doctors who will be sharing their perspectives and experiences at the ground level. And I would like to first welcome Dr. K.N. Namare from Juwai Civil Hospital, Dr. A. Thanbo from Great Provincial Health Hospital, and Dr. C. Samma from President Parasi. Each panelist will be given around 10 to 15 minutes to share their experiences and insights. But before we start, I'd like to request everyone who are participating to kindly mute your microphones and unmute only when you are addressing the panel. So, secondly, I would also like to inform all participants that we will be running a question and answer round at the end of the discussion. Kindly jot down and send your questions in the chat section and direct it to the respective panel. To start off with the discussion, I would like to call upon Dr. K.N. Namare. Doctor, we realized that with MHIS funds, Juwai Civil Hospital has managed to do a lot of things and to significantly transform to a certain extent from MHIS funds. Of course, with the support of very active MS, Dr. Mrs. R. Forman. So can you kindly explain to us how were funds significantly utilized in the Juwai Civil Hospital?
Respected DHS and the CEO of MHIS, Dr. Aman Swar, sir.
I think you have to unmute yourself because you are not audible.
Am I audible now? Am I audible now? Hello?
Yeah, you're audible. You're
Okay.
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 Others kindly mute. Others kindly mute. Yeah. Yes, doctor, please go ahead.
Hello?
Yes.
Hello? Hello? Yes.
Respected DHS and CEO Dr. Aman Warsar, Madam Wan Swan, all panelists,
Dr. Panbo, Dr. Sangma, Engineer Ipala,
and all staff of SNA MHIS and district heads, greeting to you all this morning as we celebrate the second anniversary of the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana. PMJY, as we know, is a milestone in healthcare started by our Honorable Prime Minister Shri Narendra Modi in 2008. I'm glad to be a part of the celebration today.
Doctor, we are having problem hearing you. I think you need to unmute your microphone.
Hello? Yes. Hello?
Yeah, you're audible.
Yes, okay, thank you. I would like to share our experience as the MHIS team at Juwai Civil Hospital about the positive impact and the changes that the MHIS fund has brought to our hospital. There are so much we can do to help the public seeking medical help, and with the fund available, both the public as well as the medical institution can be benefited. We as the MHIS team at the Juwai Civil Hospital have seen a new breakthrough, especially in the past 2 to 3 years, where the MHIS fund has significantly transformed the way we have delivered our services to the patients. Now, I would like to say there are two people who are benefited from the MHIS fund. First is the patient himself. Those who seek medical help benefited the most. And the second, again, I would like to say that it is the patient himself who's benefited, because no matter whether we are procuring instrument or when we procure any kind of equipments, we are using them for the benefit of the, or for the better services of the patient themselves. Therefore, no matter what, I think the first and the foremost who benefit is the patient themselves. Now, firstly, maximum part of our fund is utilized for providing cashless medical treatment to the patient. We are procuring medicines and injectables that are needed and prescribed by the doctors that are usually not supplied by the state. In doing so, we are trying to bridge the gap as much as possible so that the patient don't have to buy medicines, as we know that patients who came to the government hospital are usually the poor and the underprivileged. We at present provided 100% cashless transaction for blood tests, X-ray, ECG, OT charges, and anti-rabies vaccine at Joy Civil Hospital for patients who are having MHIS beneficiaries. Now, 95% of cashless transaction is being done for SNCU admitted babies, and around 80 to 90% cashless transaction is being done for the general cases. Till date, we have reimbursed around 75 lakh to some of the patient for the investigation and the medicine that they have procured outside. Secondly, one of our big achievements in the field of using of MHIS fund is the purchasing of an eco ambulance amounting to near about 4.5 lakh for the transportation of the patient and other emergency services of the hospital. Now, with the fund available, we are actually also paying an honorarium to one sonologist doctor who would come once or twice a week to help us with the ultrasound scanning. Actually, we have an ultrasound machine, but we don't have a radiologist. Now, out of the patient admitted as an inpatient, we have recorded a 13 to 15% of them who have a smart card. And for those who doesn't have a smart card, our PRO would help them to get one. Until date, we have registered 1,498 patients. That it means that we have helped them to make new smart card during their admission at Joy Civil Hospital. In addition to these, some of our major purchases are 2 patient shifting trolleys in OT amounting to about 1.6 lakhs. Then we have purchased 2 radiant warmers amounting to about 1.3 lakh. Then some suction machine, some spotlight for use at labor room. We have also purchased 4 labor tables which are on the way to enable us to deliver better services. We have provided AquaGuard drinking water, which are to be installed also in all wards and OPD waiting rooms for the patient, which will be done in just a matter of few days to few weeks. Even though we are a 100-bedded hospital, we also have overflow of patients admitted most of the time of the year. Therefore, we have also purchased extra folding beds, which can be used for the comfort of the patient who are sleeping in the corridors. Now, we have purchased 2 autoclave, big vertical autoclave, and also dental autoclave for sterilization purpose, which is procured from the MHIS fund. These were urgently required at that time for the proper functioning of our hospital, OT, and also for the labor room. Now, in addition to these, we have purchases, small instruments, furnitures, mobiles, tablets, laptop, computer accessories, printing machines, Xerox machine, which was done for the smooth functioning of the MHIS department. Now, with the availability of fund, we have also purchased 3 CCTV cameras and also a good alcohol breath analyzer for surveillance and other legal purposes. So we have carried also some IEC activities within the hospital premises from the MHIS fund. Now, of late, with the outbreak of the pandemic, urgent preparation at the time need to occur. So what do we do is that for preparation of the isolation ward, we have used the MHIS fund for the cleaning of the new isolation ward, for the purchase of BMW materials, some surgical instruments, POL, eateries, mobiles, and other small things. And I think we'll not be able to mention all the minor details that we have purchased, but these are some of the major achievements, Stacey, that we have done till far at Joy Civil Hospital.
She's not audible.
Of course, Doctor, your efforts has really shown in the transformation of the hospital now. So we really appreciate that. I'm sure a lot of hospitals have gained a lot of insight and inspiration from your talk. So besides that, Doctor, did you face, what are the advantages that you think that because of the existence of MHIS funds that you have had, what are the advantages?
Regarding the advantage of having an MHIS fund, I would like to say that the best part of this fund is the flexibility of the fund. The flexibility of the fund, which is at our hand, to be utilized on a priority and urgency basis. Now, as we know that a government hospital always have to run 24 hours a day and 7 days a week. And equipments and machine breakdown can happen anytime. And sometimes for the repair of this machine and equipments, if we have to go through a lengthy process to get an approval for the repair, that means we have to wait for almost weeks and months. Now, that is one main advantage that we have, this MHIS fund, is that we can urgently use this fund on a priority basis because it is in our hand and it is flexible to use according to the need of the internal matters. So one thing is that once we have this fund with us, we can tackle this problem at the earliest for the smooth functioning of the hospital. I will give you one example, Stacey. For example, recently we at the blood bank, our generator was spoiled. So if we have to ask for fund for the repair of this generator, which is at the blood bank, it will take us week to month to get an approval. And you know, we can't wait that long, because once the electricity has gone down, naturally we need a backup from the generator immediately. So using this fund, we have repaired the generator at the blood bank so that whenever there's a problem with the electric supply, the generator will back up all the blood products so that to prevent the spoiling of these products. So this is the first one. And secondly, I would like to say that the problems and requirements is different in different hospital setting. Now, with the availability of this fund at hand, because it's flexible, like what I say, we can always identify the internal problems and solve it at the internal level with the help of the medical superintendent and the MHIS team as a whole in the hospital. Thirdly, I always felt that to a certain extent, with the availability of this fund, it has generated some sort of employment among the youth. I think these are the 3 points that I would like to put in the forefront regarding the advantage of having the MHIS fund at our own institution.
Thank you, Doctor. Doctor, one last question. What are the challenges that you face with regards to implementing MHIS and especially with utilizing funds of MHIS?
Regarding the challenges that we face, now with the health insurance in place, the challenge that we face is always the lack of manpower and the availability of other departmental services, diagnostic services like pathology, biochemistry, and radiology. By saying that, I mean to say that with the proper functioning of the MHIS nowadays, that people are aware, the public are aware, patients from different part of the districts and the periphery, especially from West Jaintia and other from the War Jaintia side of our district, they begin to pour out from the periphery towards our hospital for the inpatient services and the outpatient services to avail the benefit. Now, one of the reasons is because we know of the availability of specialty services at Joy Civil Hospital, number one. Number two is that because these patients, they have the card, so they want to use it naturally to avail the benefit. Now, in the periphery, most of the time, there is a problem with internet connection. So usually they cannot claim the MHIS card that they have. So naturally, they will come to Jiwai Civil Hospital so that they can avail the benefit. So one thing is that while saying so, what I mean to say is that on one hand, we have the increase in the patient load and the increase in the paperwork that has to be done. And we have the same sanctioned staff that was sanctioned decades ago. So in one way, we have increased load, and another way, we have the same staff that are there working. So there is an increase in the load. That is one challenge that we face with the coming of the MHIS. And the second problem that we face, as always, actually, is the poor and the fluctuating internet connectivity. I think the poor and the poor fluctuating internet connection. As you know, the Jiwai Civil Hospital is situated at Yelong, which is a village level, which is far away from the town. So at times we used to face problems with getting internet connection. I think this is the same problem that is being faced by the primary health center and the community health center at the periphery level, where there is a lack or a poor fluctuating internet connection. And lastly, I would like to say that sometimes the poor and the fluctuating motivation of the staff, especially in the government setup, is one challenging that the MHS team in each institution may have to face in dealing with the MHIS Pradhan Menteri Jan Arogya Yojana. I think these are the few challenges that we face. Stacey, back to you.
Thank you so much, Dr. Great. So now I would like to request our CEO, MHIS, Dr. Aman Was, also the DHS MHIS, to kindly give us an insight of the general perspective on the significance of MHIS, because when it comes to procurement and other things, we've always informed or always kept DHS, the directorate, in the loop. So from your point of view, so what is the general perception and the significance of MHIS?
Yeah, very good morning, Stacey. Very good morning to all the panelists present here. Thank you, Dr. Lamari, for your insights and for your inputs. Now, this implementation of the MHIS in public hospitals, introduced as a claim revenue sharing model. I think Stacey has already mentioned about that. The same model was carried forward and improved upon during the implementation of Pradhan Menteri Jan Arogya Yojana and Mega Health Insurance Scheme. And over the year of implementation, hospitals were able to utilize these funds as per the pattern breakup indicated below. I think all of you are aware of this. 70% is infrastructural upgradation of the institution, 25% incentive to staff, 5% reversion to state nodal agency, that is the Meghalaya Mega Health Insurance Scheme. Now you've heard Dr. Lamare saying that through this fund, a lot of things could be done in a jiffy. I mean, it's very fast. It's very true that in the government system, if you have to procure anything, if you have to buy anything, if it is an emergency, it takes time. That we have to accept and we have to agree, because we have to follow certain norms, certain guidelines, and certain instructions. But with the coming of this MHIS and the benefits being enjoyed by the beneficiary and indirectly the institution, I think this is the crux of the scheme. And over the last few years, since inception, MHIS has been very instrumental in helping improvement of public healthcare infrastructure and quality service in the state. We have seen, like Joy Civil Hospital and other hospitals, so many other hospitals, they needed an ambulance. The only time taken was the communication from the institution proper, that is Joy Civil Hospital, to the headquarters. That was the only time period which I think there was a delay in that. Otherwise, if it had been through the normal government procedure, I think 1 year also it takes, I think you'll be lucky to get it. And you've seen that also I have already conveyed to the higher authorities. If I want to buy an equipment as proposed by any other hospital, government hospital, by the time we get that equipment, it is already obsolete. But with MHIS, you need it, you get it within 6 months. I mean, max 6 months. From a figure of 1.2 crores in 2013-14 utilization in public health institutions, it has gradually increased to 22.65 crores in 2019-20 in the entire state of Meghalaya. Major procurement like generators and inverters has to a great extent addressed problems like power shortage. Till date, 14 generators has been purchased from MHIS funds. And let's not forget also that incentive for the staff, that also plays a crucial role. And for every service being provided, for every effort being taken, there is an incentive from this particular percentage. And we have found out and we have seen that this incentive has in fact boosted the morale of the people working in the institutions. And it has made the scheme come out in a proper way and implementation as per the guidelines put forth by the government and the agency. 3 ambulances have been procured in 3 district hospitals. We have already spoken about procurement of so many equipments, even up to the level of CCTVs, drugs, then small equipments. Whenever there is an emergency, they could be purchased through this fund. And one beautiful thing about this scheme is that when we have this in-house or pharmacy lab tie-up, this has helped the patients reduce the out-of-pocket expenses, especially the deprived and vulnerable section of the society. Not only that, we have got the health engineering wing people here with us. Major and minor constructions also could be done through this fund. So as Dr. Lamare had said, the beauty of this scheme is the flexibility. And as Constacy had said, that we from DHSMI also, we are always in the loop because all the medical institutions falls under DHSMI. So for all your proposals within the institution, it has to come to the DHSMI. And for every purchase that you make, which falls under the purview of the CEO, where you have to get the concurrence of the CEO. I think from the MHIS, they are very fast in forwarding all the letters from all the institutions. And we from our side also, we are very liberal. Certain areas where it will take time for us, that we know, that we anticipate that it will take time from us, we always give that approval. Hence, there are so many equipments, ambulances, generators which you could purchase, because from here we are very liberal, and we know that if such proposals come, it means that your MHIS scheme there in the institution is very, very active. That is why you have got these funds. Now, with the outbreak of COVID-19, you have seen that we had to do a lot of renovation, a lot of modifications. Then you have to bring a lot of equipments. Some, like RPHS hostel, had to bring in CCTVs. And you had the MHIS funds, and the government also was liberal enough to say that use from the MHIS fund. Right from all the government institutions here to Negrams, they have been utilizing these funds. Until July 2020, an approximate amount of 1.68 crores was spent towards COVID-19 from MHIS funds in most of the claiming hospitals in the state. Lastly, it may be added that MHIS supports and assists the health department by addressing gaps in the public health care infrastructure and service delivery. Because of the ease and autonomy in utilizing funds, the most important requirements are identified and immediately met at the PHC, CHC district level in due course of time. Funds generated under the scheme would help in sustainability of the health system in the state. And finally, it is true that in the rural areas, we still have issues like connectivity. This also was flagged with the government authorities, and it was informed to us that the government is going all out to see to it that connectivity issues are improved, and connectivity in all the villages across the state be in a satisfactory manner, and they are tying up with certain companies for the improvement of this connectivity. I thank Constacy for moderating this, and I know that the panelists we have here are people dedicated to their institutions, and they have performed commendably in their spheres of work. I wish you all the very best, and I would like to continue this discussion with participation of other officers. I've got the DHS, MCH, and FW here with us. We've got the state manager here. We've got the SDO, Health Engineering Wing. We've got the Director of Finance, and all the staff of MHIS here with us. And we expect, and we are confident that this scheme will be taken forward for the benefit of the citizens of the state. Thank you.
Thank you so much, sir. Sir, as you have rightly said about incentives, that is also one of the major discussion in our major point of discussion today. So I'd like to call upon our next panelist, Dr. A. Hanwo, who has adopted a certain methodology of incentivization staff. And we've seen his work in Mohirambam CSC and also now in RPHS. There has been major transformation, and I think most of it could be attributed towards performance of staff. And Doctor, can you kindly share us your input on how did MHIS contributed to effective performance of health workers in the hospital and the model that you have adopted?
Respected Director, sir, Dr. Amanwar, Joint CEO, Dr. Wanswet. Good morning, sir. Good morning, ma'am. My co-panelists and all my colleagues and all from other subcenter PhDs and CHCs and referral institutes. Well, to talk about incentives, yes, incentives. Earlier, it was in the mode of in MHIS 1, 2, 3. It was in the mode. The percentage was 30%. 70% was for upgradation, and then with the advent of PMJ MHIS, now we have 70% for upgradation, 5% for the SNA, and 25%. And if we go down to look down at to 25%, from this 25%, 50% has been allocated for the doctors, 12% for the nurses, then 8%, 9% for the paramedical and other health workers. Lab techs get 4%, X-ray technician 4%, PROs 8%, and then for administrative costs we get 8%. Yes, I mean with this incentivization of the staff, it has brought in a lot of changes. I mean, most of the staff have been motivated. They found some source of inspiration to perform their duties effectively. It has also percolated down to there was a document last year from the National Health Authority where they said like at any given day and time, 40% of the health staff are usually absent. So the rate of absenteeism in our hospital, for that matter, I can speak for my own, has decreased, no doubt. And with the incentivization of staffs, most of them, what I've seen is they have improved, their self-esteem has improved, they have become more responsible. And for the few, who've been working very hard with or without incentives for that matter, with the advent of MHIS PMJ, they have put in more efforts. So when there's more efforts, there's more workload. And with MHIS and implementation, of course, the workload has increased. And I'm very surprised, but not shocked. And then I'm very happy too. Like a lot of staff have come up with innovative ways and ideas, and to ease their work, despite the heavy workload, especially now in the COVID crisis time. So they've become more creative. With regards, I think incentivization had a role to play there. And what I've seen is now, since everybody is part and parcel of the scheme, for every equipment that we buy in the hospital and all that, these staff also have, they've had the sense of ownership. So when you have a sense of ownership, they tend to take care more of the materials or the things that have been handed over to them to work with. And with the distribution of incentives, like we have a system there in our hospital where actually only though we monitor our people very, very closely, right from the doctors right down to everybody. So the more you work, the higher your incentives will be. So what has happened is like some do question, why am I getting less and this one is getting more, we're in the same rank, same. But ultimately it has created a sense of healthy competition, even among the doctors, among the staff nurses, because I get very less amount today, this time, and the next quarter, my fellow colleague gets more. So definitely something is wrong. And then messages are being delivered to them, like, maybe you're not performing well in this sector and this, that. They pick up in the long run. But and with the incentivization, another plus point has been like, it has definitely been away the doctors from the private sector. More and more doctors are willing to join because of the added incentives from MHIS. So these are the bonuses of actually giving incentivization through the scheme. And if you say like the model that I've developed which we've developed in RPHS hospital, it's been based solely on performance. We are giving incentives based on your performance, and your performance has to be documented. So like in the case of doctors, like we're giving 50%, like, you've written there from the 50% of the 25% that is given to, certain percentage is given to the main doctor and then the supporting doctor and then the doctor who attends an emergency. In our case, it's like we felt like, the most important part of a of a doctor's role is at the time of admission, whether proper history is taken, examination is carried out. So each and every doctor who admits a case is given a point system. We're all given a point system. You're given 3 points at admission, and then you're given 2 points for every round that you do, 1 point for for every emergency call that you attend to, and for 1 point for every discharge. So all your point system at the end of a quarter are calculated and converted into percentage, and then from the fund that's allocated for incentive for doctors, as per your percentage, it will be distributed to you. So basically, we are also improving in our documentation because we are actually now writing what we're doing. We do something, we write, and it's recordable. I mean, so nobody has any argument because it's documented the amount of work that you've put in. So that has made everybody up. Okay.
Dr. Arwan,
Yeah.
can you speak a little louder, please?
Yes, sir.
Nearer also, nearer to the mic. Yeah, you're not. I mean, you're not very audible.
Okay, sir.
Yeah.
Okay. What we have
Are you
is
alone there? Are you alone there?
no, sir. Someone is here with me.
Okay, because your mask is masking your voice.
Oh, okay.
Yeah.
No problem, sir. Okay. Actually, it's my teeth. Actually, we have a system where doctors are being, point system has been awarded. So for every admission, you get 3 points. For every round you do, you get 1 point. For every discharge you do, you get 1 point. And for every emergency call that you attend to, based on how quick you are, you'll get 1 point. But you have to write it down on the case sheet. So basically, it helps us in our documentation also. It will reduce our rejection rate later on after discharge of the patient. And basically, all the doctors at the end of a quarter will be given, they will have collected certain points, and that is converted into a percentage. And from the incentive fund which is allotted to the doctors, that percentage will be given to that particular doctor. The same thing, like what we have with nurses and fourth grades, it's slightly different because like documentation of their documents, I mean, getting a documentation report is very difficult. So what we've done now is we basically looked into their casual leave records, the earned leave records. And each and every nurse and fourth grade, what happens is their incentive is calculated at per day rate. So when you calculate per day rate and you take the number of earned leaves and casual leave that a particular nurse has or fourth grade has taken, we multiply it and you'll get the total number amount that that is due, but the concerned person was absent at that time. So it was deducted from the main amount. So in 1 quarter you'll have 90 days. You'll have 90 days. So basically, if the rate is 30, so we multiply 30 into 90, you'll get the exact amount of what one particular nurse will get. So you deduct the number of days for CL and casual leave, that the rates of number of days and casual leave, of earned leave and casual leave. So you'll get the amount. So that will automatically reduce the number of absenteeism among the staff. The same thing which we are doing with the fourth grades. But in the case of lab techs or in the case of X-ray technicians, so what we've been doing is like for the first part of MHIS 4, we had X-ray technicians who refused to do night duty. So we didn't give them incentives. There were 4 or 5 of them, but they refused to do night duty. So they were not. I mean, we need emergency services. We wanted our services to be 24/7. Same thing with the laboratory technicians. But laboratory technicians, they have been working and they've been doing round the clock. So things move. So what we're doing with our incentives is we're making sure that people actually get the incentives and they're walking the talk and going that extra length that is needed in a health setup. So that has helped us tremendously right now in this time of COVID crisis. When we were at one point of time were a functioning hospital with no emergency services. Now we're up and running with 24/7. So basically, our things have improved just from our incentive model. But of course, we still do have problems. I think other PHCs, CHCs or other hospitals are still distributing incentives based on equal share and all that. So that is good. I mean, when you're starting off, and at the same time, what is most important, what I feel is most important is at the same time when you distribute incentive, you have to take into consideration the upgradation fund that you're spending in. Suppose now you have lab techs, 4 or 5 lab techs, but you go to the laboratory and they have no equipment to use. So how do you measure their works? How do you measure the effort that put in? So the upgradation fund, you have to make sure that equipments have been procured from the upgradation fund. Staff have the tools, have the tools to actually use them to improve the hospital services. That's when you can measure the work that they put in. So upgradation fund and incentive fund have to go hand in hand. Okay. Have to go hand in hand, and at the same time, this will help measure the performance of each and every staff. And this has percolated down to a very, very healthy competition among all the healthcare providers, right from the doctors right down to the fourth grades and all that. Because what we've managed with this system, which we've done for a year now, we've managed to grade our staff, we grade ourselves from A group, B group, and C group. A is excellent, B is good, and C is fair. So definitely the C ones will be getting very less amount, the B will be getting a slightly higher amount, and the A will get a extremely high amount. So when you get your SMS, when your incentive is being debited to your account, credited to your account, you'll get an SMS. So you'll all be sitting down and saying, I got this much and I got this much. And basically the one who gets the least will always keep quiet. So they actually, an indirect message has been sent to them that, you are there to perform. But having said that, because like initially what we did was like we distributed incentives equally to everybody. But that has not percolated into really increase in efficiency or responsibility. So we were forced to take the step. Of course, we all know that in any setup, when there's 100 people working on program implementation, it's usually the only 5 people who put their heart and soul to it. 20 to 3% are absent, 40% are honest bystanders, and the rest are ready to just sit back and let others do the work, but pretend actually they're actually in the loop of things. So basically, we want to monitor things. Of course, we need a more robust system, for monitoring and all that. Now we've installed CCTV cameras, which is in the process. And then what we're moving forward is like we are going to get a accounting software, which I've come across in one of the private hospitals. What they've done is like each and every staff, suppose now I go to the ward and I don't see water, I don't see an electricity bulb. All I have to do is put in an SMS and then it flashes on the monitor and the concerned person, say electrician, gets an SMS that's saying that this particular electricity bulb in that ward is not working, so you need to replace it, so he has to do it. And until he doesn't do the work, that message on the main monitor will not disappear. So that's a very good monitoring system. Plus, you make that add that with CCTV cameras. So basically, you have full monitoring and surveillance of each and every staff when they are on duty. So basically, effort put in by everybody will be acknowledged. I mean, the ones who are really working will be acknowledged, and the ones who aren't will have to step up. They'll be told to step up. So monitoring surveillance will have to come together with surveillance, and at the same time, monitoring surveillance will have to come together with incentives. Incentives should be distributed that way, and at the same time, incentive is totally dependent on the upgradation fund, on what equipments did you buy. Did you buy the tools? Did you procure tools which will be made use of by your staff properly? Like for some, but one thing which I'd like to stress upon, like infection control practices for sweepers and all that. Now they're the front line in our fight against COVID. So earlier they never had moppers or this 3 bucket system and all the very complicated stuff for infection control. Now we bought those tools, we got them, we gave them trainings and all that. And one more thing I would like to add is like we had a lot of trainings. Each time a staff enters a training, that is added to your score for your incentives also. So capacity building also is part and parcel of the incentivization process. So basically, we are trying now as hard as possible to monitor and up the system. It is not yet perfect. We are trying to, plug in the loopholes. I think with time, maybe when the CCTV cameras are installed, and maybe when we one fine day we'll have an accounting system, which I've seen it has worked in the private sector. Maybe we will be up there in speed, and then maybe the whole lot of 100% will be effective and putting in more and more of what is asked of them. I mean, when we say incentives, incentive is actually a definition of incentive is being a reward for a job well done. So as it is, when you do a normal job, you get your salary. But when you get
I'm sorry, doctor, to cut you short. I just one last question.
Okay.
I'm sure because it's most public hospitals, it's government set up, and so employees tend to be the subject. So, are there any challenges that you face at the initial part, the initial stage when before all the performances of the health workers were performing well and all that?
Yes.
So, doctor, what are the challenges that you face in the initial stages? Because I'm sure a lot of hospitals now are still going through that stage where they have not achieved motivation through incentives. So.
Yes, lethargy. Yeah, some of them are still lethargic and still in their own world. But a lot have picked up. Those who got hold of what the program is actually, what the scheme can do for them, have picked up because they've been motivated. But there's still a lot to be done. Okay, so like I said earlier, with effective monitoring and surveillance, and then gradually motivating, and then we have some inspirational people come and giving a talk here now and then, and all that, and then copy paste some brilliant practices from other institutes of the country. If they get hold of that information, most of them will definitely pick up. But they are picking up. Things were not what they used to be before. Things have progressed. Like now, I think most of our institutes are doing very well in documentation, which has resulted in lower rejection rates. So regarding to documentations, most of the documentation is usually done by the nurses. Okay, and then and some part for the food grades nowadays also are into documentations of the work they do because of the waste generated and all that. So yes, a lot of lethargy has been stepped aside, and then people are slowly coming into terms with, like, what is asked of them and what is needed of them. But a lot still needs to be done.
Thank you so much, Doctor. Thank you so much for all your insights and reviews. We would like to go ahead with the next panelist. Our joint CEO, Dr. N. Monswet, also the DHS MCHNW. Madam, you've had very good experience with MHIS, especially in DDS than it does. So, Madam, we'd just like to get a little general perspective from your end on how MHIS has been able to bridge the gap on medical record maintenance. Has there been any improvement with contribution of quality assurance, in which is also an important agenda of the National Health Mission? Madam, you are not audible.
Hello, Stacey, can you hear me?
Yes, madam. You're audible now.
Thank you so much, and a very good morning to all the panelists concerned. As regards the bridging of the gap in medical records maintenance, yes, we have definitely seen that has been an improve because, like, initially when MHIS was started in the first phase 1, 2, 3, we have experienced a lot of cases being rejected because of improper or not complete documentation. So before the start of MHIS 4, the state nodal agency has come up with the uniform formats for the IPD patients, as in patients' tickets, as in consent forms, as in nursing records, as in OT procedure notes, and as well as in the OPD section, as for the different packages, special packages like for ANC package, for minor, for daycare, for minor procedures, and as such. So these documentation, these uniform formats have enabled, like, the doctors and all the nurses and everyone concerned to really document all the processes that are really
you're not audible again.
Am I audible, Stacey?
We can hear.
Yeah.
So, we can hear.
So these uniform formats have enabled the doctors as well as the nurses and to document all the necessary processes that needed to be done. And we find that because of these complete documentations, like most of the claims we have realized most of the claims. And these documentations, these case sheets, right from the registration and so on and so forth, are being uploaded by the Ayushman Mitras into the server, into the system. And you know that these can be also retrieved at a later stage whenever we need it. So these, especially like it also helps, like, in certain cases, especially in certain cases of medical legal and all that, and of course in general as well. So we have found that MHIS has gone a long way in improving the documentation at all the health facilities, I believe, and as well not just on documentation but as well as on record keeping and as well as maintenance. Now, as regards the quality assurance. The quality assurance, yes, we know that quality assurance is a part and parcel of quality care for a health setup, and it is also one of the components, one of the programs on the NHM. Now, when we talk about quality assurance, the components are number one is service provision, secondly is patient rights, thirdly is inputs, then fourthly is clinical management, fifthly it talks about infection control, then about quality management and outcome indicators. Now, when we look at the service provision, definitely we have heard from the previous panelists, Dr. Lamare, as well as especially from Dr. Lamare, as well as we have from Dr. Arwanj. So we have heard that as far as service provision, MHIS has contributed so much in improving service provision at the health facility. Now, when we come about patient's right, then the right is, as in the field of patient's right, the MHIS has enabled to bridge the gap or to do away with the financial problems that a patient may have, because MHIS has reduces or it has done away with the out-of-pocket expenditure. Now, when we come to the inputs, we have heard from Dr. Lamare the same experience which they have experienced in Jowai Civil Hospital. The same has been experienced in Ganesh Das Hospital also, where I was there for a long time. So MHIS has contributed to the improvement of infrastructure, where we could have do repairs, we could do major renovations. Then as well, it has a role also in putting up the setup for disaster prevention. Like for example, it has enabled us to put up fire safety equipments and do the mapping. And also, most essentially, it has contributed to boost the human resources, because we could, through MHIS, we could employ like technical staffs, nurses, technicians, as well as non-technical staffs also. Also, MHIS, we could do, as I have said, major renovations, or rather major assets, like we could even do a central oxygen line for the sick newborn care unit in the hospital. Now, when we come to the clinical, to the support services, when we come to the support services, yes, it has been, as by the previous panelists also, it has been able to provide financial support for like testing, calibration, and all these for regarding the quality control, like for EQAS, all these could be funded through there. And also, like, it has enabled for the hospital who has been under strenuous strain or water constraint. So through that, using the utilization from the MHIS fund, we could have our own tube well. We could pump the water, and this has ensured a 24/7 water supply. And also, we could provide power backup to almost all the wards in the hospital. Now, coming to the clinical care, as I have pointed out before, the formulated formats have definitely defined the whole process, right from registration, consultation, admission, treatment plan, continuity of patient care, nursing care, rational use of prescription of drugs, updating patient records, and as well as storage. Now, when it comes to infection control, yes, it has been mentioned by our by our previous panelists also. Like these have contributed a lot where we could expand the biomedical store. We could the adequate like consumables like those bins, toilet bags, trolleys, fogging machines, and other consumables we could procure from MHIS. So we have seen as far as quality assurance is concerned, MHIS has greatly contributed to overall quality management as well, and it has resulted in positive outcome indicators.
Madam, just another question on, yes, of course, MHIS has contributed towards the quality assurance. What about other programs of NHM? Has MHIS been able to contribute anything towards other programs like maternity and child programs under NHM?
So yeah, definitely. MHIS has definitely, especially in regards as maternal child health program, because like there are special packages there. Like for example, the antenatal package. Then we have the postnatal package, and especially for the sick newborn care, which usually before in the previous phases of MHIS, usually the newborn is taken along within the ambit of the mother. But with this MHIS4, like a special sick newborn package have been created and has definitely go a long way to improve or to rather to reduce the morbidity and the mortality of a sick newborn. As well as we have other packages like for the pediatric patients as well. And then also the others also in general, like the dental package, the day surgery package, and also on and so forth. So definitely as far as maternal child health concerned, the package itself has been a great help to the mother, to the patients. But and as Dr. Lamri has pointed out, whatever we have given into like infrastructure, improvement of the labor room, improvement of the kangaroo mother care unit, like the sick newborn care unit. These have really greatly benefit towards improving the health of the mother and the child.
Thank you so much, madam. Thank you for all your words and for all the insights that you gave. I'm sure all of the participants, and especially hospitals, must have gained a lot from the information that you have provided. Now we will go on to the next panelist. I would like to call upon Dr. C. Samma. Dr. C. Samma from Resibel for CHC.
Yes.
Dr. C. Samma, we would just like to get a few words from you on how has MHIS helped in developing health care infrastructure, both in medical infrastructure, especially in construction, in terms of construction work in the hospitals.
Okay. First of all, respected Dr. Amanwar, Director of Health Services, MI, respected Madam Dr. N. Wansworth, Director of Health Services, MCH and FW, and all my co-panelists and all who have joined in this program. I would like to wish a very good morning to all of you. And I'm Dr. Sanjay Sangma, Manager, Resibel for CHC, North Garo Hills. As Stacey has already mentioned, today I have been asked to share in brief how MHIS has helped in developing the healthcare infrastructure, both medical infrastructure and construction work in the hospitals. Well, I have been working in Resibel CHC since 2011, and prior to introduction of this MHIS in the state of Meghalaya, we used to face lots of difficulties in running the hospital smoothly since the funds for maintenance or the upgradation of the hospitals were very low. So we used to face shortage of surgicals and other equipments required for management of patients. But after the introduction of MHIS 1 in the state, we started enrolling the beneficiaries and started claims, though it was quite less during phase 1. But once MHIS phase 2 started, more people enrolled themselves and claims also increased. So we could slowly upgrade our hospital to be a more equipped hospital, and with a better infrastructure for the patients. So I would like to share a few things which we have undertaken in our hospital to improve the overall infrastructure as well as the medical equipments in our Resubel for CHC. First of all, like we have made sure that since we used to have lots of problems due to frequent power cuts, we have installed 15 kVA generator, which could serve us during OPD hours or even at night times when there is no power. So after installing this generator, now we don't have problem like in operating the X-ray machines or the lab equipments whenever there is power cut also. And this generator has covered the whole hospital building, so it has really helped us in providing a better service to the patients. And moreover, we have also installed inverters for all the rooms in the hospital, be it like OPD, emergency, labor rooms, or the wards or the paying cabins. All has been covered with inverters. So at night time also, if light goes off, now nobody has to be in darkness. So it has been a great achievement for us in terms of power backup. And coming to this upgradation of laboratory, prior to availability of MHIS funds, our laboratory doesn't even have a proper microscope, I would say. Like we used to have problem regarding microscope also. But now, after this MHIS funds, our laboratory is well equipped with good microscopes, even biochemistry analyzers we have procured, even CBC machines and other lab equipments. So I would say like our laboratory services have been improved to a great extent. And coming to this upgradation of labor rooms, now we have upgraded our labor rooms with good quality labor tables, with geysers, with spotlights, and all the required materials that needs to be there in the labor room for functioning it in a smooth way. So it has been a great help for us in improving our labor rooms to a better quality. So, and another thing, like coming to this upgradation of wards, all those things, cabins and all. Before, like prior to this MHI's funds were available, like our hospital beds were already like spoiled, some like what to say rusted. So we could purchase new beds for all the wards and all the cabins, and we could even establish the new children's ward with the help of this MHIS fund. So the patients now they get a better beds with a better mattress and all this patient attendant stools and patient attendant beds. So it has been a great achievement for the patient side as well as for the attendees also. Then another thing coming to this conference hall, but like before we were not having a proper conference hall also. So even the district meetings had to be conducted in Mendipatar or PHC where new building is there for the CHC, since we don't have space out here in the CHC. But now with the MHIS fund, we have established a good conference hall with all the sound systems and projection systems. So now we can conduct all the trainings and the meetings out here itself in the district headquarters. And we have already, yes.
And all of these initiatives that you have done to MHIS fund, are there any challenges, any specific challenges that you have faced that you want to share?
Pardon?
In all of these initiatives that you have done through MHIS, did you face any challenge? Was there any challenge?
Till now, there has not been much hurdles, but since these lockdowns have started, or this after this Corona COVID-19 situation, the procurement of materials has become a bit difficult. But we are managing somehow from some suppliers, but then it has not been like before, but we are facing some difficulties. And recently we have established a TrueNet lab also. We have procured biosafety cabinet and refrigerators and all the materials required for setting up this TrueNet laboratory. And we have started testing this one for COVID-19 also in our TrueNet lab. And like other upgradations, there are lots we have done, like the emergency rooms have been upgraded. And for the patient attendees also, we have arranged good sitting arrangements and with TVs where they can spend some time. And we have even upgraded our hospital storerooms, even doctors' rooms, nurses' rooms, and even the hospital signboards and signage and all. And even this waste management also, we have improved a lot in waste segregation systems and disposals with this MHIS funds. And we have even installed intercom facilities for the whole building, like every room is connected with the intercom, and now it has made the communication easier for all of us. And even the CCTVs we have installed in all the buildings and even the outside premises, so that at least some security is there for us. And like other this one consumables, surgicals, and computers, printers, laptops, and even air conditioners for the OTs, dental dental rooms. All this have been installed. So since like before, like we were not having even one AC in our OT, it was quite difficult for us to conduct even the thebectomy programs. But now after installation of ACs in the OT, now we have conducted thebectomy programs in last 2 consecutive years, but this year it could not be conducted. So even in these times of COVID-19, it has helped a lot, like in procuring PPEs, N95s, and other required materials. So I would say like this MHIS infrastructure fund has been a big blessing to all the hospitals, I guess, and then especially for us, it has been a big blessing. Like without it, we could not have been able to improve the hospital to where it is now. And I'm really thankful for this initiation of this MHIS also. And it has helped the patients also, like before they used to face difficulties in procuring medicines. Now they're getting free treatments and free laboratory services. So I would like to conclude like she's saying this MHIS has been not only for the hospital infrastructure, but for the beneficiaries as well as the hospital. It has been a big blessing, and I wish the MHIS in the future to be a successful one. Thank you.
Thank you so much, Dr. C.A. Sharma. So before we go to the next panelist, I'd like to remind everyone, all the participants and even the panelists, if they have any questions, kindly note it down in the chat section. Thank you. So for the next panelist, I'd like to introduce Shri E. Pala, SDO West Hassi Hills, representative from the Health Engineering Wing. Sir, we've had a lot of construction work undertaken under MHIS. Some major construction work like construction of hall for immunization and extension of blood bank and construction of biomedical waste. There's a lot of construction work that has happened under MHIS. However, we just wanted to understand from your end, from the point of view of Health Engineering Wing, what are the challenges that hospitals face are getting that they face in getting the proposals done, and whether the construction works done under MHIS are in line as per the same lines as for the Health Engineering Wing.
Good morning, Tracy. Good morning, sir, ma'am, and all the panelists, those who are in this link of this program. So, actually, the contributes to the infrastructure building in hospital.
Maybe initially, now there has not been any proper integration between HW and HMIS. So to say, but I also know that the HMIS has made a contribution towards the hospital infrastructure. Mm, But in my opinion, I feel that there is a lack of integration between HMIS and health engineering. And you said about the challenges in hospital getting the proposal done through the engineering challenge, the terms, time frame, budget, and financial implication. There are some challenges definitely for the hospital because if a hospital needs the construction an emergency ward extension of any room or anything, then the approval is required. For example, any construction within 2 lakhs, then the letter requires for the request to construction to the engineering wing. If it is beyond 2 lakhs, then the approval needs to be sent to the government. Maybe it takes a lot of time to get approval. And at the same time, since our director of finance here, since July 2019, the the government freeze and suspend the DFP role of all the officers. Then to get approval, little bit just take time also. Is any
Yes, sir. Sir, additionally, I would like to understand if a hospital has funds to construct, let's say, a quarter for a fourth grade for a fourth grade staff. So, do you think they should just go ahead with it, or why is it important to consult with health engineering wing? What are the protocols that they need to follow? What in terms of your expertise when it comes to construction work? Can you share that?
You see, if any construction, that means it's a conflicts of interest between HMIS and engineering. Like I have to mention, there needs to be the same integration between MHIS and HW. For the instance, if one hospital has money and wants to construct an emergency ward in anything, the construction and emergency ward and the room, it is important that the expertise and the knowledge of HW is also involved because for the construction, the HW has the expertise. If the HW is not involved, then if anything happens in the future, the HW will be responsibility. Hence, the best method is for the hospital to ask the proposal to the SNA, HMS, and CEO, and the HW is also informed so that the technical expertise is given. Also, it is important to integrate because HW has the same motives and that there is no duplicacy in construction and approval.
I'll just intervene here. TC, I'll just intervene here. See, regarding this construction, a decision, conscious decision has already been taken by the government. All construction works in any government health institution has to be undertaken by health engineering wing. You may have the money from the MHIS fund. If you want to do any extension work, if you want to do any major repair work, if suppose like you're saying you want to construct a quarter, then it is the health engineering wing who has to do it with the funds available with MHIS of that particular institution. The point here is this, that there were many agencies before who had been doing these constructions, okay, and then handed over to health department. And then when they hand it over, it's incomplete. Sometimes it's faulty. And it is always the health engineering wing who gets the blame. That is why for all construction works in health institutions of the government, especially the major works, this has to go through health engineering wing. Even if any proposal comes to us we always take the views of the health engineering wing from DHS MI first, and then we give the approval. Once we give the, we give the consent to the CEO of MHIS. But in that also we'll have to make it very clear that such construction works has to be undertaken by it has to be undertaken by health engineering wing. That is the crux. That is the point. Okay, not that you will not be able to spend for construction, but if you do any construction work, health engineering has to be consulted. Because later on, if there is any problem with that particular extension of building, then what will happen is it is a health engineering who will be called. Okay, that is one point. Then I will give you another point. There were these constructions of labor room, okay, baby room in the PHCs, CHCs, wherein the medical officers were asked to go ahead with the construction locally. In the process, because not knowing the electrical wiring that has been done, then the earthing which has been done, some of these earthing wires have been uprooted. And when you install your equipment there, they go out of order. Okay, and the blame goes that there is no earthing. So that is why, to prevent any such mishap later on, a decision has already been taken in the government that all construction works are to be done by health engineering work. Any construction work which has not been undertaken by health engineering wing, if there is any problem with that, then the person who has given that work will be taken to task. That decision was taken. So that is why it's always wise, any construction work that you have to do in the government building institution from MHIS funds, health engineering wing has to be consulted. Okay, thank you.
And hello, Chachi. And one thing also, if they buy the generator, inverter, anything in any institution, it should be informed to us, because why the company came and just put the generator, and the sometimes they didn't provide the proper earthing. Sometimes they just one wire from generator to MCB of the building, and then short circuits will be there. Some short circuit will be there, and blames. We have to rewiring the whole building if short circuit is there. Before they join the wiring from generator to the building, they should inform us, because we have done the work and we know from where to where we give the connection. And at the same time also, like inverter, it won't be kept like all the building, that because the doctor, those who are in that institution, they have to indicate which room they need. Then from that inverter, we'll do the wiring. Okay, thank you.
It's very clear.
Thank you so much. So, from this discussion, we have derived that it is very important to achieve this integration between the directorate, between the health engineering wing, and between the hospitals who are trying to upgrade their hospitals through, whether it comes to construction work or any major procurement, if it crosses certain amounts. So I hope hospitals have gained some input from that discussion. And before we go to our, come to the end of this discussion, I'd like to say that we are going ahead with a question and answer round. So for the question and answer round, we will be having around 20 to 25 minutes. And so we have a question. The first question is asked by Dr. Bijan Datta, SHA Tripura, regarding procurement of medicines through MHIS PMJ fund. Since this is related to medicines, and so we direct this question to Dr. K.N. Lamare. Dr. Lamare, Dr. K.N. Lamare.
Yes,
So,
hello. Yeah.
Yes, Doctor, I hope you heard the question. Since this is regarding procurement of medicines through MHIS PMJ fund.
Yes.
So, how is procurement of medicines done through MHIS PMJ fund?
We have an executive committee, which is where the members are the doctors of the Juwai Civil Hospital, where we will have a medical specialist, a pediatrician, and other specialty. And before procuring, we will take their opinion and purchase the medicine accordingly. I think that answered the question. Am I audible? Hello?
Yes, doctor. Yes,
Am I audible?
yes, doctor.
Okay.
Yes.
Did I answer the question?
May I ask? Hello, may I ask Bijan Dutta from Tripura?
Yes, yes. Please ask.
Okay, sir. If any PHC and CHC want to procure,
yes,
can they procure, or you can procure from centrally?
No, no, no. See, we are not procuring medicine. We are not procuring medicine on our own. There are some medicine that are not supplied by the state. There are some medicine that doesn't come as a supply, as a government supply from the state. And we need those medicine because we have different specialists in different field. So we have an executive committee. We used to sit once in a while, and we will take the opinion of the other specialists as to what medicine are required. And those medicines that are not there in the government list, we used to procure them and use them for those patients who are admitted, who have an MHIS smart card. I think that answered the question.
Okay, okay. Thank you, sir.
Thank you, doctor. With regard to the second question, so I will answer it directly. So packages such as CT scans are not utilized in PHC. Hence, the need for medical record maintenance of such packages are not required. We mandate record maintenance. So is there any other questions from the participants?
Hello, madam. Hello.
Hello.
Are you audible? Yes, actually, this question is mine. That is now standard treatment protocol. Some the document, that is chest X-ray, urine culture, CT are mandatory. But in some PHCs and CHCs, these facilities are not available. For those cases, what are the documents your state are submitting? That's my question. Actually, same problem we are facing. That's why I'm asking.
Can you develop and specify you don't need?
Stacy, you're not audible.
Yes, you are not audible, madam.
Packages such as CT scans are not utilized in PHC. So hence, the record maintenance for such packages are not required. Is that clear, sir?
Okay, okay, okay. Thank you.
Stacey, can I ask some question, please?
Yes, sir. Yes, sir.
Okay, good afternoon, sir, our director in the panel. I'm Dr. Nongri. This is Nongri, Joint Director, Civil Hospital, Shillong. I have some highlights here regarding the present scenario of COVID-19 patients in our hospital. As of now, we have got 33 registered patients, COVID positive patients. And out of this, the process has been initiated. And I would like to just say thank you for the MHIS PMJ, which has initiated this scheme. And we are thankful for the government also. A lot of patients, COVID patients, has come to civil hospital. And as per the protocol, we have to give a free treatment to all the patients. But still, we enroll them through MHIS. Most of the medicines which are to be given for the COVID patients are very expensive. So we are using this opportunity to enroll them in the MHIS, and through MHIS only, we are able to register now almost 63 numbers of patients, COVID-19 patients. This is one benefit which we have received from the scheme. And the others, there are a lot of things in civil hospital which has been benefited for the patient also. As of now, we have got hello.
You are not audible. We cannot
We have
hear you.
what? Can you hear me?
Yes,
Hello.
doctor. I can hear you now, doctor.
Recently, I was just for the recently there was a breakdown of our Xerox machine, which we have to Xerox during the time of COVID in the month of April, May. And this Xerox machine was it's quite old, but with the help of MHIS scheme, we have tried to procure a new one. And this was a great help to us because in that time, there were a lot of emergency things to be done, to Xerox and to type and to print out papers and letters. And most of the form are not in a, we cannot print it, we cannot send to the press immediately. We have to do it in our hospital. So these things have helped us very much. And basically, even non-COVID patients, we have got around, in my record, so many equipments have been procured right in the 2019. Basically, these instruments has been, we cannot wait from the government. In 2019-20, furnitures which we have procured is around 2,04,000, and medical equipments is around 4,25,000. So seeing this scheme is very, very important. And out of that, the incentives which we are giving for doctors recently, we have at least 25% incentives to all the doctors. And this will boost their morale to work for the entire hospital, to bring it up, and especially to give a good care to the patient. So from my side, still there are challenges we face regarding enrollment. But we are trying to overcome it. Our staff and my staff to do the needful, to enroll them what and all that what they should do. So many challenges are there. Stacey, am I audible?
Yes, sir, you're audible, sir.
So many challenges are there, but still we are very, very grateful to MHIS, PMA, GAY. Through this, many patients has been benefited. Thank you.
Okay, thank you so much, sir, for sharing all your all the things that has been done in civil hospitals, all the efforts that has been put, especially that you have highlighted them. Thank you so much. So that would be the last question. This is to inform everyone, and that if you have any further questions, since we are running out of time, kindly mail to us in at state.manager@mhis.org.in. So before we end this discussion, I'd like to request the panelists to kindly give a few words as a closing remarks.
Sonata, you come and speak.
Hello, Stacey. Should I say something first?
I'd like to call upon. Can you kindly restrict it to 2 minutes? I think I would like to request Dr. Amanwar or Director MI to kindly give a few words of.
Rishi.
Yes, sir.
Said I've already spoken. I think we have heard, we've got a lot of inputs and insight from so many of the doctors and participants here, right from health engineering wing doctors. All of have appreciated about this scheme, and we would like to take it forward, make it better, make it more friendly, okay, people friendly, beneficiary friendly, and let's hope that we can carry this forward. It is a pride of the state that we have got such a scheme, and with all the hard work put in by all concerned, all stakeholders, we know that the final outcome is the the benefit which goes to the citizens of the state and the satisfaction that they derive from such a scheme. Thank you.
Thank you, sir. Madam, would you like to say and give a few words?
Yes, Stacey, as a last word, we have heard, and we from the different health institutions that have benefited, that have utilized the MHIS fund in a very positive way. I would, from my part, I would just want to urge or to motivate all the health centers, especially in the public sector. We talk about most of the district hospitals have felt the benefit of the scheme. So the CHC, the PHCs, I would urge, I would motivate upon all my colleagues, like they take responsibility of the scheme, see that is being implemented, and that it will go a long way into provide the psychological satisfaction first and foremost for us as health providers. So with these few words, thank you so much, everyone. Thank you.
Thank you, madam. Sir, Shri Ipala, can you kindly give a few closing remarks, few words as closing remarks?
The words I say, we get a benefit for construction. So to say, the day I joined in Northstone, then I have a discussion with the MS of Tirot Singh Memorial Hospital, because she want an emergency room with a little more than 10. Then we have a discussion. Then I told her, at present we won't have scheme. Then we discussed both of us. Then she wrote a letter to the SNA, State Nodal Agency. Then she seeks approval from CEO. Wrote a letter to our sir. Then we get. Then that scheme now we all 90%. Otherwise, if this pandemic is not there, we completed now. But 90% we are completed. Thank you. All these things. Thank you.
Dr. T.N. Lamare, kindly give a few words.
Yeah, thank you, Stacey. Lastly, I would like to say that the MHIS is like a double-edged sword in the hands of a willing soldier. By a willing soldier, I mean a proactive MHIS team, motivated hospital staff who have set their minds and motives to uplift the quality of service delivery at the public healthcare facilities. And the enemy, as we all always know, is poverty and insufficient fund. And lastly, I would also like to thank Aman War sir, who is our CEO, and also Madam Wanswet. And I believe under your dynamic leadership at the state level, you will continue to guide us, you will continue to motivate us in the future. And I would also like to thank the SNA for organizing this program. After listening to our other panelists, Dr. Panbo and Dr. Sangma, I felt that we should do more because there's always room for improvement. And I congratulate the other panelists also for the achievement. Thank you, everyone.
Thank you, Doctor. Now, I'd like to request Dr. Panbo to give us a few words.
Thank you, Stacey. First of all, we'd like to thank our director and CEO, Dr. Aman War, joint CEO and Director MCH and Family Welfare, Dr. N. Monswet, Mr. Ipala, SDO West Coast Hills, our co-panelists, Dr. Sangma, Dr. Lamuri. Thank you very much for sparing available time here. Just want a few suggestions for the SNA before we all part. I mean, we have a lot of institutes in the state who are performing extremely well in MHIS implementation. I just hope that the SMA will carry forward the best practices of different institutes, so that there's an amalgamation of all the best practices, so that replicated in all in other peripheral and state institutes, health institutes, so that it'll be a boost for the public health system here in the state. So there'll be less dependency on the private sector. I mean, we all are doing a good job, but there is, like Dr. Lamare has said, room for improvement, and I hope we all will work together towards it and achieve universal health coverage for all, especially for the people of our state. That's all. Thank you.
Lastly, but not the least, I'd like to request a few words from Dr. C.A. Sangma, please.
Yes, thank you, Stacy, for this time. I would like to thank Dr. Amanwar, Director of MI, and Madam, and all the co-panelists, and then all those who have joined in this beautiful program. And I just want to wish that this MHIS or the PMJY will be a blessing to all of us, all the beneficiaries in the rural as well as the urban, and it will bridge a gap that the health sector is facing in Meghalaya, and it will improve in all the PHCs also, and like in terms of public health delivery system. And I would like to, as Dr. Lamare has said, that we should all strive to give a better facilities and improve the healthcare system in our state with this MHIS also. And that would be all I would like to say, and thank you.
Before we end this very interactive and very fruitful discussion, I'd like to thank the panelists, each and every member of the panelists, our Director of Health Services, MI, CEO, MHIS, Dr. Amanwar. Thank you so much, sir, for being with us today and taking your time to give your input. Thank you very much, sir. I'd like to thank our Director of Health Services, MCHFW, Joint CEO, MHIS, Dr. N. Wanswet. Thank you so much, ma'am. Shri Ipala, SDO West Khasi Hills. Thank you so much, sir. And our doctors from Dr. K.N. Lamare from Diwai Civil Hospital. Thank you, doctor. Thank you, Dr. Panvo. And thank you, Dr. C.A. Sangma. I'm sure everyone is very busy, especially during these times, but you have taken your time out to be with us and make this program a success. Thank you so much. So before we go, I would like to inform everyone that this is the first webinar being organized by the SNE, Meghalaya, and we hope that these kinds of sessions can continue in the future, so that we will be able to learn and share our experiences. Once again, I would like to thank all our panelists and participants for joining us today. Thank you to the staff who have put in all their efforts. Thank you to the staff who have put in all their efforts in making this program a success. Of course, with the support of our CEO, MHIS, and Joint CEO, DHS, MCH, and FW. I had forgotten to earlier mention our Finance Director also, Shri Paul Kamji. Thank you so much, sir. Thank you, everyone.
Thank you. Thank you, Stacy.
Stacy, thanks a lot. Yeah, all the SNA staff, great work. Thanks. Yeah.
Thank you.